Question: if you had to go to a doctor right now for anything from a simple checkup to checking on a potential problem, do you know where you would go and who you would see? Problem is, most people don't think about it until they need medical help. Village Medical invites you to establish a relationship with a primary care physician. As Dr. James Gerasi explains, they can monitor the little things to avoid big problems and make sure you have the right care if things change. Dr. Gerasi, first of all, thank you for your military service, but what made you decide to go into medicine? It's kind of a personal story.
I got into this particular type of medicine, which is servicing the elderly population, and value-based care was really my experience with my own family. So my mom, who was remarkably healthy, retired nurse, career nurse, very well insured, financially stable, played tennis 3 times a week all the way up into her 90s,
wow.
Was extremely healthy all the way up until she wasn't. That's when we realized, which was too late, that she didn't have the right health care coverage or have the right capabilities wrapped around her. Yes. And so that's what really motivated me to do this.
So if it's difficult for people who have that information at their fingertips, basically, then imagine how difficult it can be for so many other people. So about Village Medical, first of all, it's a team-based primary care approach. Let's start with those 2 words, primary care, and what that really means.
A lot of our health care in the United States is focused on sick care. So when people get sick, we're really good at diagnosing it and making them healthy. Maybe we're not as good as we should be at keeping people healthy or preventing illness, and that's really what primary care is about. It's about taking care of the whole person and taking care of their health, maintaining their health, and keeping them from getting sick.
Yeah, and it's not just the doctors. You have your nurse practitioners and your pharmacists as well, so it has to be connected.
Right. I think one of the differentiators for Village Medical as a value-based care company is that we realize that the physicians can't do it all themselves. Me as a physician, I can admit that, and that team-based approach is so valuable, having physicians, advanced practice providers, nurses, clinical pharmacists, as you said, and also our care management team and our other clinical support specialists, all coming together as a team to wrap the services that are needed around a patient.
All right, Medicare's annual enrollment period. This is one of those things that, because it can be confusing, a lot of people think they're going to get to it and then they put it off. Why not to put it off?
Yeah, so I mentioned my mom and her experience. People all think that they have the healthcare insurance or coverage that they need all the way up until they discover they don't, and it's often too late. So we in primary care really focus on the annual wellness visit, so maintaining that regular visit cadence with your primary care doctor. And I look at annual enrollment for Medicare as the same way. For older Americans, for older folks, being able to kind of assess annually what their health status is and how that's changed, and how that may have changed their needs for different types of health insurance, and also understanding that healthcare plans change every year and it's hard to keep track. And so it is just a reminder during the AEP period for folks to take a look at their health status and also to look at their health insurance.
Yeah, because what covered your doctor last year might not cover them next year. Prescription costs can change as well. Right. You don't want to be surprised.
Absolutely. You may have had a new medication added, you may have a new therapy, you may have a new diagnosis, you may want to go to a new doctor in a new clinic, and then only to discover that the changes in your own health plan, that's not covered, it's out of network. And for you, that's no longer a good plan.
Yeah, so look at things like, have your medications changed, needs for medications changed, has your health changed, have you moved? Right. All right, so choosing someone who can guide us through this, you all have advisors who can help us with that as well.
You see ads on TV during this time period about Medicare and Medicare Advantage, et cetera, and it can be very overwhelming. It can seem to be just too much for people, but the truth is there's a lot of resources out there. You can go online. We have resources on our website, which is www.villagemedical.com, and they can give you information relevant to AEP. You can go see one of our doctors or clinics, and they can refer you to a trusted advisor who is a specialist in health insurance, and they can advise you. Getting one of those trusted advisors to do a free assessment of your current health insurance status and to help you find the right plan is really critical.
Yeah, okay. When it comes to finding the right plan, though, one of the things that we naturally do, because a lot of us are under some economic pressure, is to just look at the price tag. Don't just look at the price tag. Your health is priceless.
Small differences in price could be very huge differences in coverage. You need to look at your state of health, as I mentioned, your healthcare goals and wellness goals, and then you need to see that that plan is matched to those needs as well as your goals.
Yeah, starting with, does it cover your primary care physician?
Yeah, every year we have patients who, they don't pay attention during AEP, they stay on their same health plan, only to find out that their current primary care doctor who they've been with for years is no longer in network for their plan. And that's really, really sad because that relationship between patient and primary care doctor is so important.
Yeah, so jump on that now, avoid the stress, because as we know, stress can cause other problems.
Exactly,
right?
exactly.
All right, Dr. DeRossi, thank you very much.
Oh, my pleasure.
That's right. Stress causes mess. If you're looking to make changes in your Medicare coverage, a checkup would be a good idea so you can be aware of any changes you might need to make with your plan. You can also book a benefits review to better understand your plan options. If you don't have an agent, you can call this number right here, 888-383-5077, Monday through Friday from 9 a.m. to 5:30 p.m. Their Patient Experience Center will connect you with a local independent insurance agent. One more time, that number is 888-383-5077. Remember, don't wait until it's too late.